Greetings to one and all. On this very significant day, that is the World Mental Health Day, I, Inayat, have the privilege of enjoying the company of people dedicated to the field of mental health. Now, may I have the honor of handing over the mic to the spirit behind this show, Professor Gabriel Ivbijaro, the Secretary General of the World Federation for Mental Health. Over to you, sir.
Thank you very, very much, all of you. Good morning, good afternoon, good evening, wherever you are in the world, and it gives me great pleasure to be sharing the platform with all of you today. So I'm going to share my screen so that at least share my screen so that at least you can you see the screen? Okay, good. So first of all, let me thank all of you wherever you are for taking the time, to join us on this special occasion. And I'm going to start by paying sincere thanks to our patron for World Mental Health Day, Her Royal Highness Princess Imam Afzan Al Sultan Abdullah of Malaysia. She's been our patron for the last 2 years, and really she's done so much to transform and what we do and ensure that we do continue to do the right thing. So your Royal Highness, the WFMH is grateful, and I'm personally grateful for what you have been doing to help us. I'm also very grateful to the Secretariat of the United Nations. We've been well supported from the United Nations Secretariat. Lizette and Ingi have been very helpful, ensuring that we were in good communication with the Secretary General's office, so making sure that the things we need for this event, we are having them on time. So many people around the world have supported World Mental Health Day. This is a very great campaign. I have been involved with campaign for World Mental Health Day for the last 10 years, but I must tell you that this year has been one of the biggest I've been involved with. We have many volunteers all over the world who are donating their time. We have people who are supporting us financially. We have people who are providing ideas for what we do, so really very grateful. And most of you will have seen this year's logo for World Mental Health Day. It's different from the past, So we have been very lucky that Samantha Ford, a doctoral research student, University of Birmingham, agreed to provide a concept for us to use for this year. And I'm really grateful because she managed to put in many discrete ideas from all over the world, people saying, I want a crossroad, something else. She managed to put all together into this coherent picture that all of us can see and we all love. So Samantha, thank you very much. When you look at it, there's a heart in the middle, which symbolizes the soul for all of us. Then you can see the round circle, which is the world, and then you can, you can see that in various shade, basically saying that we are all equal and together we do make a difference. So really very good. I have a very good technical support, from the Secretariat, and young people from India and globally. So they've been helping. So really grateful to them. Without them, this would not be possible. Hitesh has been, very good coordinating young people. You have, Steve coordinated with me in London, and Mario, working on the IT. We also have a good legal team that ensures that the things we're doing are up to date. But what is well-being? Because this year is about mental health and well-being, so is there any science behind it? So of course it is, because I've looked at, some document from the OECD, looking at what do people tell us. People are telling us that well-being is not an illness issue. It's about the whole thing that makes us human. It's about income. How do we ensure we have good income for what we do? Health, not mental health, it's about health. That, the mind and body together. Jobs, we need to have jobs, education, good environment, freedom to choose. The communities will belong to governance and life satisfaction and individual control. That is what World Mental Health is about. This is what this year is about. That how could we advocate for parity for people with lived experience? How do we have the good laws that govern the things we do? Because sometimes, you have laws, that may be disadvantaged. So it's about telling you that we need to fight to ensure that we provide satisfaction and opportunity. Environments matter, you say, because you could live in a very bad environment, you will never have well-being. So those are the things that this year World Mental Health Day is about. And and I was just going to give you some more science behind it. This is a research that was done in 2009 in Australia, looking at an ethnic community, the Aboriginal community. And what did they say about well-being? They said from that time that it should be a life course approach. So from infant, childhood, adolescent, young adult, middle age, and later life. And in addition, you must have good schools, primary school, secondary school, employment. You see, the word employment is coming back again. So they said about that. You need a community that are close together, so that we feel people will support each other. But one thing that struck me when you look, anytime you have a global event, it does have an effect on life, on the well-being and life. So, for example, if you look at now the COVID-19, so the effect of COVID-19 will last a very, very long time. So we need to think about that. So therefore, we have to begin to think about how do we tackle those things that will come from that. The current flood in Pakistan is another example. The war in Ukraine, the war in Yemen. So really, what the people that thought about World Mental Health, they thought about that we have to be our brother's keeper. They will have to walk to the world where we can actually say one day there will be no wars. So really, we need to think about those issues. So really, what you should be doing is go to your government, go to your, the policymakers to say, what are you doing to help to support schools? What are you doing to help to look at housing? What are you doing for employment? Because if you have mental illness, you earn less than the rest community. So really, what are we doing to empower people to be able to make a good living? Somebody asked me, how was this year's theme chosen? But what we did was that in the past, first of all, the WFMH would choose a theme and we announce, but we decided that actually we want to involve the world. We want to involve citizens. So the board, mandated the Secretary General, that's myself and my team, to listen to people, to suggest title and theme. And then we put them together, and then we set up a group survey monkey for people to vote. And make mental health well-being for all a global priority was the highest vote. That's why we chose it. But one lesson for you, if you want your theme to be chosen, you have to participate. You couldn't be outside it, So join WFMH, send a concept to your government, who can even send to us a regional VP. I'm very sure the person that suggested the theme, make mental health well-being for all a global priority, is very, very proud of what he or she has done to ensure that we get into this situation where the theme she or he chose was what was voted for. And so it could be you next time. So think about that. Think about how you can be part of those activities for choosing. So once we did that, what did we do next? So we developed what I call a global brief, where we look at what things happening all over the world. What are the issues? What are the challenges? What do we mean by priority? So we then developed a global brief that was sent to all the ambassadors and sent to various parts of the world for people to think about and start beginning to conceptualize what they want to do. But so what are the issues that we thought about? Again, these slides helps you to think through about it a bit better. So you can't have well-being without good governance. So that's one of the things. So really, we need to be good laws, good governance, good policy, because I think so that is one of the things that we should be fighting about and thinking of. I also talk about what's called cultural norms. We have to work within cultures and societies, but there are some norms, that are not conducive for good health. So for those ones, we need to challenge. There's some parts of the world where women may not go to work. They are not going to work. Why is that the case? There are some where, so this are, there are some where I say refugees should not be part of the system. Why should that be the case? So those cultural norms should be challenged. You have to argue for education, because if you educate the public, the population, you get better outcome. Occupation, income, gender issues, And so when you look at that, then you bring it to what they call the fabric of the system that will lead to social cohesion. We tackle psychosocial factors. We look at behavioral issues. And you see biological factors are least, because often when we are ill, we want biological factor, we want medication. But there are many things you do before you get to medication: prevention, promotion. And even when you take medication, there are other things you can do to develop resilience. That means we need a good healthcare system. But the healthcare system must interact with the social determinants of health. So when you have this together in a coherent way, then you are talking about well-being. So it's not illness, it's about well-being. So really it's you as advocates, really, so this, what we're saying is, go to your government and ask, what's happening local to your area, ask questions, set up support groups, in your area. If you think, some people, people are retiring early, maybe they have something to contribute. Young people can support the older adults, so it's a holistic approach to care. It's a holistic system. This is what this year is about. So I'm going to go through some conditions and for you to understand a bit more what we're talking about. Gender-based violence is a global public health issue. There's no part of the world where it doesn't happen. So really, but how can that support well-being? It's unlikely to support well-being. So intimate partner violence, we should challenge it where it is, That's part of this year's World Mental Health Day. See, non-partner sexual abuse, again, that's what we're talking about. As told already about traditional practices, where some of them are not the best, for good health. So where it's happening in your community, go to your elders, human trafficking and child sexual abuse. We will never achieve mental health well-being without tackling gender-based violence. So I think, that's very, very important. We need to start arguing for that case. There's this good paper that's been published by the World Bank, gives a good summary of it. It tells you what the issues are. It tells you what we need to do, and tells you that it should be one of our priorities as part of mental health. So if you're an advocate, you advocate for mental health, then you should also be an advocate against gender-based violence. It's not easy. It is difficult, but talk to your parents, talk to your friends, talk to your brothers and sisters. Let them be the example, because they say sometimes in Africa they say charity begins at home. So let them be the example you want to show. You at home, how do you bring your children? How do you relate to your sisters? How do you relate to your brothers? So really, so very important for us to think about that. We have to think about mental health literacy, very important, that we need to begin to familiarize ourselves with people with mental illness. And this will start from school, because if you don't do that, what happens is that you come to the extreme end of the curve where people are afraid of people with mental illness. So, but what we want to do is to actually, there's nobody that's immune against mental illness. There's nobody that will say they don't have a family member with mental illness. There's nobody that will say they don't have a classmate with mental illness. So really, so how do we think again and make something that people are afraid of not to be afraid of? And so we need to begin to invest in schools, as I said earlier on. And we, for example, in European countries where they looked at schools, they found out that, sometimes schools do not promote healthy lifestyle. Sometimes they do not support, anti-stigma campaign. Some schools segregate boys from girls, too early, So some talk, so the curriculum sometimes do not support what we're talking about. So after today's Mental Health Day, go back and see what's happening in your schools. Go to the school teachers to say, what are you doing? Can I help you? Is there any way we can? The WFMH will be happy to support, So really key for us to look into that. There could be no well-being without dignity. So one of the work I did with some team of experts was looking at dignity in mental health after the older adults. Often, the older person is treated badly in many parts of the world. They tell you they are absent, they are silent, but we shouldn't be so. That we have to fight for the rights of the older person. And so one of the things we are working with is trying to work with the United Nations so that this can be entrenched. So really, so some of you will have ideas. People like Samantha who understands activism. So we'll be needing you to help us to think about how do we create this space for the other person to be valued. They have so much to offer, so why should they be hiding? So really, so World Mental Health Day tells us that we cannot do without that. See, if you look at radio, television, everywhere, you are talking about migration, migrants, as if it's plague, as if it's, really it's not, because there are various reasons why people are moving, man-made disaster, wars, So really, so we have to think again, how do we support migrants, How can we make them be part of the society? See, in England, people don't want migrants. In Italy, don't want migrants. In Nigeria, they don't want migrants. South Africa, they don't want migrants. Italy, Canada. So, everybody don't want migrants, but people migrate. So really, so actually to say that we are all migrants, we're moving. So the beauty of the world is ability to move, but some people get stuck in crisis. So really, so we want to pursue psychological first aid again as one of the things that we want to use to support people. When I was the president of the World Project for Mental Health in 2016, psychological first aid was the theme for World Mental Health Day, but we didn't achieve enough. So we need to come back to it. It's a very simple process with evidence-based, about look, listen, and link. It's a good, evidence-based activities. Why is it that we are not doing it? If you go to a football match in England and you have a heart attack, everybody knows what to do. They even have a defib, everybody knows. But if you have panic attack, people will run away from you. If you have epileptic fit, people will run away. So we've spent too much time about treatment and less time about community education. I told you earlier on that we have to be part of the community. So we have to find that way that the community is, and we are the community. So we've included psychological first aid into our WFMH agenda for the next 3 years. We want to develop it better. We want to make it available, like Red Cross does all over the world. So it may be that you want to be part of that, or you have ideas. We'll be very happy to talk to you. Another burning issue is suicide prevention. Today, I listened to the Lancet, Commission, the job that was launched today, and one of the things they said was that 20 countries in the world still criminalize suicide. Nobody wants to go kill himself. That's the case. So really, so how do we support families so they're able to talk about their distress, so that they don't hide, there's no shame about somebody's feeling so distressed that they want to end their life, So really, so key important, so part of this year's theme. We did some work also ourselves, because COVID-19 has been a huge burden on society and what did we find about suicide prevention? We found out that suicide is preventable. So that's first in place. It's a preventable condition, and therefore, we can do something about that. We have to invest in the labor market. If you remember earlier on the presentation I gave you, there was something about how do you invest in labor. So we need to invest in the labor market so that people can feel employed. We need to have strategy for mental health. We need to support people who are vulnerable. So we've got 8 good principles that, based on some literature review, which are coming to you, you should all ensure that you have national suicide prevention strategy in your country. So I would suggest, ask your ministry, which of these are you doing? Because really, what you don't want is, for us to give you all this theory, but you need to be true activists, So what have we come together with? We've come up with 3 pillars to support this year's theme. We call it the role of the peoples and NGOs. So yourselves, we're the people in the WFMH asking, challenging communities to do the right thing. We look at the role of professionals and community leaders. I said professional and community leaders. Professionals cannot do it alone. Community leaders cannot do it alone. So they need to work together. So for example, in places where you have traditional healers, how do you use them to be part of the solution? I'm proud to say my grandfather was a traditional healer. So I understand the discipline of traditional healers, I understand there's some good ones and some bad ones. Maybe we need to be thinking about places where it occurs. How do you accredit them, the ones who are doing the right thing? And I put government at the base of the triangle. You need good governance, good government. So the government will pass laws. They may pass wrong laws. So really, so we have to find a way that, we get the correct laws for our people, for you to do things. Let me stop for a second just to say something very special. I say mental health is very, very, very lucky. We'll be very lucky to have the current Secretary General who has been very kind to mental health. His main mental health is priority. Last year, he gave us a call to action. You know, he wrote the call to action for last year. And this year has been a busy, difficult year, but he still gave his time, you know, to support us, you know, to give us messages, to give us hope, you know, because I told you governance matters. Remember I said that laws matter. So if you cannot influence the United Nations, we cannot do anything important, you know. So I'm very grateful, you know, to our Secretary General, because really it's been there for all of us, you know. He talks about mental health. He talks about anti-stigma campaigns. He talks about investment in health. He talks about those things, you know. So really, so, you know, so we are very lucky, you know, and his secretaries are very good, you know. I send emails and I get response, you know, and so I said Lizette and Niyi are very, very good people for us, you know. So we are very lucky. As long as we have our current Secretary General, let's continue to influence the global agenda. So it's about influencing the global agenda, and you should use your government, use your ministry, you know, to do things, you know, about it. And more importantly, he promised to send us a message, which we're due to have. I think it's almost time for it, you know. Let me just look at it. Yes, it's time for that. So let's hear the message from the UN Secretary General, you know. So I'm going to stop sharing, and then we hear the message from the UN Secretary General. Thank you for listening. Let's hear the message first, and we'll come back.
I'll be sharing my screen now. Just a second.
Okay.
It is live. Okay, I'll share my screen now. Can you see my screen?
Yes.
Is it visible?
Yes, it is.
It's not very clear. We can't hear it clearly.
Sorry?
I couldn't hear it clearly.
Is it not audible?
No.
It's muted.
Yes,
There's
it's
no
not audible.
Okay, just a second. I'll share it again. I'm sorry for the technical glitch. I'm very sorry. Is it audible now?
Oh, can you play it for a second?
Is it audible?
No, it's not.
No?
No, it's inaudible.
Just a second. I think
Nearly 1 billion people live with a mental health condition. But mental health remains one of the most neglected aspects of healthcare. Some countries have only 2 mental health workers for every 100,000 people. The social and economic repercussions are profound. Anxiety and depression alone cost the global economy an estimated $1 trillion per year. We must strengthen the capacity of health services to offer quality care to those in need, in particular young people. This includes community-based services and integrating support for mental health into broader health and social care. Investing in mental well-being means investing in healthy and prosperous communities. We must also address stigma and discrimination and break down the barriers that prevent people from seeking care and support. And we must prevent the root causes of mental health conditions, including violence and abuse. The United Nations is committed to working with partners to promote mental well-being. As we mark World Mental Health Day, let us make it a global priority and act urgently so that everyone, everywhere, has access to quality mental health care.
So will we make the message from the UN Secretary General available to all immediately? It's also been translated to all the UN languages, and we also have them in document that we're going to release immediately. So really, so if our Secretary General has made it clear to us that it's a mandate for us to do something different. And the UN cannot do it alone without member states doing things. And we cannot do it alone without you helping us, So this is a great challenge for you, a challenge for all of us. First of all, I'll tell you, first of all, circulate the video because it's released now on our website now, and it's going to be on YouTube. Use it, circulate it, send it to school, send it to people you know. So because really, say tell them you want a difference, that we cannot keep on, having this answering the same question with the same answer, that we need a different answer, different solution. The 1 billion population not having what they need. It's terrible, isn't it? So that concludes my own section of presentation. But as I said, we worked very, very hard. And I want to also show you some of the things that happened so far. And then we'll come back for question and answer and hopefully a way forward. So, so I'm going to hand over to Hitesh to show some of the things that we've collected so far. We also say that this is your activity, not us. Do you want to show Hitesh's presentation, please?
Gabriel Hitesh is joining in. Till then, can we see Dr. Nasir's message? You're on mute.
Okay, you can play his video now before Hitesh. That's fine if you have it available now. So the next message is from our president of World Federation for Mental Health, Dr. Nasser Losa. He said it's had 24 hours of working from one place to the other. So let's hear him actually.
Dear friends and colleagues, thank you so much for being with us today. We're celebrating World Mental Health Day. This important day in our calendar has been proposed and supported by the World Federation for Mental Health since back in 1992. We've taken this responsibility seriously, and we're extremely grateful for all the global support we've been getting from various organizations and WHO and Global Mental Health and many others, really. Particularly the regional societies have been a tremendous support on that cause. This year's theme of World Mental Health Day of mental health and well-being for all is an important message globally, because it's the first time that we've added the well-being component to our message. And you know what? The Federation was born in 1948 with a number of missions, one of them being supporting the mental health services globally, but the other one was essentially helping citizens around the world to live together with better understanding and live, remember this was after the war and people wanted to live in peace. And I think that part of our mission has needed to be revisited. And when we talk about well-being today, it's not about the absence of mental health disorders, but it is actually a better quality of life for people around the world. And this is the part that we are now taking seriously in our resolution. So the message globally is, yes, we're supporting mental health needs, but we're also supporting a better quality of life, a state of well-being globally. That has a lot to do with people accepting each other, accepting their differences, and living together in a world of peace and mental health support. So thank you again, all of you, for being with us on that important day. And we appreciate your support both regionally and globally. We promise to take this responsibility seriously, and we look forward to a very productive week with all your help. Thank you and goodbye.
Thank you very much to our president for for what he said. I want to create your indulgence actually by asking Samantha Ford, who gives to speak. If you can, I'll give back the opportunity to speak. Samantha, just to tell us briefly, how what we talked about when we were thinking about the concept and how she decided on what she wanted to do. So Samantha, do you want to quickly have 5 minutes, 2 minutes actually, just to tell us a bit,
Yes, thank you very much. It's a pleasure to be here today and to work with Gabriel alongside an advertising agency I work with in Birmingham in the UK, big agency. And yeah, it was an absolute honour really to put together the concept for this year's launch of World Mental Health Day. The idea behind the logo is kind of Gabriel's already given a sort of initial taster of it, but the idea was the coming together and it being a global issue as well, coming together to solve that global issue. So we've got the world there and the different colours as well, representing different people across the world, but at the same time being all equal and all connected. And obviously the heart is usually the thing that we associate with being healthy, but also the love and support that we can give each other as well. So that has a double meaning there, being at the centre of what we do to improve the mental health of the world. And then of course the colours of the green, the orange and the yellow here are matching the branding of the World Federation for Mental Health. So hopefully it kind of brings together the values that we're talking about today, and the values that we want to take forward as well, to improve the situation, the global situation of mental health. And we can do that hopefully by supporting each other and working together.
Thank you very much, Samantha. Because as I said, you can ask me questions, so I'm going to have to take. I'm happy to take 2-3 comments from people, because as I said, this is about you, not about me. It's about us. So Samantha, obviously you're going to write for us the thinking. We're going to publish it because people have been asking. People have said, they love the idea. It's not medical. It's not illness. So we'll wait to see your publication. Does anybody want to add any comment or anything? Just raise your hand, and then as long as we can see you, we will give you the opportunity to talk. If you want to say anything, unmute yourself and you can talk. Okay, I don't think people have questions, that's good. So one of the things we've done, as I said, we've put together, a lot of, images, So do you think, Nihat, you can link to the website and show some of the images from our website, to show what we've collected so far? Can you?
Yes.
Okay, good. So go to the website and see, because just to show that truly we've gone around, collecting things, so that it's not just from London or United States. So do you want to show some of it,
I'll do that right now. Just a second.
Okay.
Okay, I'll be sharing my screen now.
Okay.
Is my screen visible?
Yep.
So these were the events. So we have compiled some of the pictures from various events happening around the world in this gallery section of our website. These were the images from Zimbabwe. Very powerful images. This event happened back in September. Then we have our event from Delhi, India. It was on World Suicide Prevention Day, September 10, Lights of Peace. Next, we have another event from Delhi, India. It was also conducted on September 10, World Suicide Prevention Day. The name of the event was Outlive Hope Through Action Festival. Then we have an event from Nigeria. Then again, an event from Zimbabwe. And we are still adding more events that will be happening today. That is the World Mental Health Day.
Thank you very much. So really, so we've, what we're showing is that we've said we create a slide for everybody for activities. So we are collecting information, and then I'm going to work with Samantha and the team to put it together in an album, so that people can see, because to show that actually we have come of age. We can talk about our illness. We can be proud of the things, So really, so I think, so this is, we're trying to end up this section. So this is what it's about. All the recordings will be made available, on YouTube and everything. More importantly, WFMH is going to be 75 next year. So really, so we want ideas, on how to celebrate the 75th anniversary. I know I already have 250 volunteers, who are called the food soldiers. I don't want 250, I want 1,000, if not more. So we're going to advertise for you to come to join. So you, as our ambassadors right now, so go and spread the message, circulate this video and messages, and be the light in your cities, in your country where you are. Be the voice, for those people who are vulnerable. Be proud to say, I belong. So I think, so this is where I want to end, and just to say thank you to all of you. I'll get back to you, once we start to put things together. Thanks to the people from WFMH, because they make us do the things, we did have a vote there, but we don't take money from tobacco company or pharmaceutical company, and yet we're surviving because of you volunteers and funders, So I think it's about, we're running out of time. I have 1 more minute left. So I want to use this minute to thank Iyad and the team, from the young people who we say we're going to invest in. So we say if we invest in the young people, the future will be better. So I want to say thank you to all of you, because really they work 24/7, and they're all the time available. When we demand something, they do it. We say we want something, they are done. They're very technical. I'm not technical. So Zainab, all of you, so, we're going to publish your names and photograph on our website, because you've made this year. Steve, Hitesh, Mario, all of you, Samantha, you've worked very hard. I'm proud of what you've done. As your Secretary General, I want to say thank you, and thanks very, very much. We'll get back to have a reflection. We can do better. So for all these successes, it's to all of you. And for the failure for today, it's mine. So once more, thank you again, and we'll get back together. Thank you, and bye-bye. Bye.
Okay, so as every beginning has an end, the time has come to bid adieu for now. But before winding up, I express my gratitude to Professor Gabriel for this very enriching session. I'm also thankful to all the participants for sparing their time for this meet and for being a very patient audience. Last but not the least, I thank my team for the backend support. Thank you one, thank you all.